Advanced directives are any type of document that explains or relates to end-of-life wishes. So the simplest form of an advanced directive would probably be the DNR, which is the Do Not Resuscitate form people sign when they don't wish to have CPR performed or go on a ventilator and so forth. Then we move from there into things such as healthcare surrogacy forms, where you name somebody you wish to act on your behalf in the event that you become unable to express your own wishes regarding end-of-life care. Then we have things such as 5 wishes and living wills that go into a little bit more detail about what types of treatments may or may not be acceptable. And then we have the POLST document, which is an actual physician order for life-sustaining treatments that takes those wishes and turns them into an actual order, makes it official, signed by the patient, signed by the physician. It is a document that really drills down in some detail as to what level of care is appropriate. And it is not a document where you are necessarily going to say, do not resuscitate me, or don't do this, or don't do that. You can use it to say, I don't want to be on a ventilator, or I don't want feeding tubes, or I don't want dialysis, or I don't want transfusions or antibiotics. But you can also use that very same document to say, I do want those things. So it really is a wonderful tool for fostering conversations and helping to drill down and get people to think about exactly what they would like things to look like as their disease progresses. The discussion should also include a frank discussion of the natural history of whatever disease process is in play and what treatment alternatives may be offered. In states where the legislature has adopted the POLST, the document actually transfers from one medical institution to another. So whether it's an EMS person, an emergency medical transport, a hospital, a nursing home, any type of institution where you are would be obligated to honor the POLST in states that have enacted it. Florida is not such a state. So in Florida, if you execute a POLST, it is valid within the institution where it's executed. So for example, if you fill out a POLST with Chapters Health, anywhere you go within Chapters Health, it would be honored. If you went to a hospital, they are not obligated to honor it. Now, our experience has been hospitals are generally very grateful to know what people's end-of-life wishes are, and they have honored it. If you don't, the state proxy statutes come into play, and that would mean that in the state of Florida anyway, the spouse, then children, then siblings, and on down the line would be your default medical decision makers. For most of us, of course, that's absolutely fine. These are people who are usually close to us, know what's important to us, and would make good decisions on our behalf. But it's not always a good choice. Sometimes one of these well-meaning individuals might not really be able to execute your wishes because it's contrary to their belief system. So having a healthcare surrogate really avoids all of that. And it's a simple document. It's a very simple document to execute. We usually introduce the concept of POLST and other advanced care planning at the time of admission. The first nursing visit, it is again discussed, and if the patient and their loved ones or spokesperson is willing to sit down and move forward at that point, we do. If not, we leave information. We talk about it, ask if there are any questions, leave printed information, and then circle back around with our social services specialist, who will again go over this at their first visit. And oftentimes that is where these documents are actually finalized, at the social services specialist visit.